Hello everyone, we are back with our health economics vlogs. Today we are going to address one of the most important concepts of health economics, not only health economics, economics in general, which is called the opportunity cost. So let's go. So first things first, if you ever made any course, any 1 hour course in economics, you are going to know about the economic problem. This is something that every single one of us has to deal with in our lives, which is the following: we have infinite needs. At least I have. There's infinite things I want to do, and there's no resources for everything, either because I don't have enough money or I don't have enough time. And believe me, it happens to everyone in the world. Now, this is the economic problem, and this is what economics is set to study. That's why I like to call economics the science that studies choices. So we have this problem, we have limited resources for everything, and because we have limited resources, we have to make choices, which we wouldn't have to make if resources were unlimited. We just could do everything. Now, every time we decide to make a choice, every time we decide to spend some of our resources, we are deciding to not do something else. So if I decide to spend some money with something, buying ice cream, I don't spend some money buying chocolate. Let's say if I have limited money. If I decide to spend 1 hour today doing this video, I'm not writing a paper. So there's always a cost of doing something, which is the cost of not doing something else, and that is called the opportunity cost. Now, how do you measure this opportunity cost? The opportunity cost is this, let's call it hidden cost, right? Which is the cost of the alternative. If we want to be precise, it is the cost of the next highest valued alternative. Doesn't matter that I say, okay, I'm going to spend £5 on ice cream, and then I say that the opportunity cost is fruit. If in fact, what would give me more utility, or let's say happiness, would be to buy chocolate. So we need to count really the one that is the next one that would really give me more happiness, let's say, and that I had to give up because I decided to go with the alternative. Believe me, this concept of opportunity cost is widely used across the entire discipline of economics, but it's also very useful in the subfield of health economics. And it's very useful for decision making because every time, for instance, the people, the decision makers that decide how to allocate resources in health, every time they make a decision, they need to know exactly what they are giving up. They need to know that if they put some money to treat cancer, maybe they are not putting that money to treat respiratory diseases, and they need to be aware of the consequences that it has to be sure that the benefits, for instance, they are getting from putting the money into cancer are higher than the losses they are getting from not putting that money on another disease. This is key in health economics, and we are going to explain a little bit more during this presentation. Let's give an example of opportunity costs in the setting of the healthcare system. So let's imagine that you have some disease, you need some treatment, some hospital treatment, and you have two options. The first one is paying for a private hospital and getting treated immediately, while the second one is the most normal one, which is waiting several months and getting treated for free in the NHS. First question, what is the opportunity cost of choosing option one? So you can think about it, stop the video if you like. I'm going to ask Valerio.
Okay, so of course, here we are paying for a private hospital, so we are using our money, and we could use our money to do something else. So as you were explaining before, Luis, we might have other preferences for other types of services, goods, whatever that might be. So whatever we were giving up, and the price of whatever we were giving up, that will be the opportunity cost here, in my opinion.
Yes, that I think this one is quite simple, right? So it's the money that you spent on that. You don't spend the money on something else. And this is very important. It will depend on the person. Let's say that for Valerio, the money is to buy a car. They could have used that money to buy a car. In my case, let's say I could have used that money to spend fantastic vacations in Italy. So it will depend on the person, but that's it. Now, the second one, I think, is slightly more tricky, but I think it also tells us a little bit more about opportunity costs. what is the opportunity cost of waiting several months and getting treated for free in the NHS? So feel free to pause the video. I'm going to ask Valerio.
Yeah, this is definitely trickier to answer because here we are considering, I think, our health. So we are kind of pausing or giving up some health benefit for a certain time period. And by doing so, we are basically deciding to potentially decrease our quality of life, but we might also have an impact on our work patterns. We might have to reduce our working hours. So we might need to give up our salaries in a way. So we'll say there is a mix of intangible tangible opportunity costs. Yeah.
Great answer. There's not a lot I have to add. Just one thing that is quite common really in economic evaluations, in economics in general, is this thing that the time that you don't work, the opportunity cost is your salary. So it's nice that we have opportunity cost within opportunity cost in the example that Valerio is giving.
Thanks, Luís. I'm now going to talk about another example, but this time with the application to health economics, in particular to economic evaluation. In economic evaluations, you might know we tend to compare two or more alternative interventions for example, treating a particular patient population. Economists, researchers will tend to estimate the costs attached to the different intervention. And with cost, we're really trying to figure out two components here, resource use and unit cost. So resource use is really how much you use a certain service or how much you use a certain product like a medication. So you can think about 2 visits to a GP, 3 hospital admissions, 4 tablets of a certain drug, and so on. Unit cost is literally the cost of that particular service or good. So 10 minutes with my GP will cost X amount of money, that tablet of medication will cost X amount of money, and so on. Unit cost, following economic theory and what Luís has just been saying, should be really linked to opportunity costs. So we need to understand what we can do with that particular resource and what will be the next highest valued alternative of that resource. So if you use 10 minutes of GP time, what we can do with those 10 minutes. In reality, in practice, can be really tricky to figure out what you can do with that particular resource and what will be the next highest valued alternative of that resource. And the way economists really deal with this problem is by using standardized unit costs, let's say, for different items, like, for example, healthcare professionals' time or medications or specific service or treatment. And we tend to use unit costs which come from published sources like the ones listed here, NHS reference cost, which is the go-to place for example, unit cost for services and treatments, and unit cost of health and social care, which is the go-to place for salaries for healthcare and social care professionals, and also the British National Formulary, which is the place where we get the information about medication costs. So that's how we treat, say, the problem of calculating opportunity costs in economic evaluations. I'll now talk about another example. We link the problems faced by NICE, which is the health and social care decision maker in the UK, in terms of locating resources. And NICE is faced with the problem of deciding on whether an intervention could be implemented in the healthcare system or in the social care system or not. NICE has got a threshold which sets how much society is willing to pay for an additional health benefit. So imagine you got two interventions, new interventions versus usual care. Researchers, economists will need to establish the cost of these new interventions in terms of producing an additional health benefit. Typically, the health benefit is expressed by QALY or quality adjusted life years. And NICE has a threshold which is basically setting up the maximum willingness to pay for an additional QALY. In our jurisdiction in the UK, this threshold is £20,000 to £30,000 per QALY. So anything beyond that, with some exception, is deemed not cost effective. Interventions that are below this threshold will be deemed as cost effective instead by NICE. But again, there are some exceptions. What is important to consider here, I guess, is when we're trying to evaluate a new intervention, not only we need to consider how much health is generated by this new intervention, but whether this newly generated health is greater than the health that will be generated or is currently generated by a different use of our healthcare resources or social care resources. So it's really a comparison about what we can get from the new intervention, what we are already getting from the existing intervention. So you can see here there is a link between the opportunity cost of what we're giving up really and the benefits we might reap from the new intervention.
Okay. And by the way, in terms of thresholds and in terms of potential problems of economic evaluations, we are going to have a series of blogs coming up. So be aware and read those.
That's it. So keep an eye out for those blogs. Yeah. So this is just a final reminder that really opportunity costs matter. And like Luís was saying at the beginning, they don't really matter only to health economics. They matter to our everyday lives, to be honest. So do consider, and we hope you enjoy this vlog, and we'll see you again soon for new blogs and new vlogs on health economics. Bye-bye.
Bye.